MBBS MD from Government Medical College, Jabalpur, and had his initial training in cardiology at Breach Candy Hospital, Mumbai. He did his DM cardiology from King George Medical University, Lucknow. He got his training in intervention cardiology at different places world over, and is practicing as a consultant cardiologist in Apollo Hospital since 1998. Currently, he is the director of cath lab at Apollo Hospital, Secunderabad. His specialty in left main interventions, which showcased it live to USA, Singapore, Thailand, and few European centers. So far, he has performed around 30,000 angiogram and more than 700 angioplasties and about 1100 cases of pacemaker and CRT devices. Now, we would start our session. Dear audience, if you have any queries regarding myocardial infarction, please leave your queries in the comment box or send us a text message. Dr. Shiv Kumar would answer them. We've already received a few questions, so sir will be explaining that. Before we start our session, let's know what exactly is myocardial infarction. Over to you, sir.
Thank you. Thanks for that nice intro. Hi viewers. It's my pleasure and privilege to spend next 30 minutes with you all discussing about the myocardial infarction. The literal meaning of myocardial infarction means myocardium means the muscle of the heart, and infarction means death of a small tissue. So in fact, myocardial infarction means that there is a small part of the muscle of a heart muscle which dies because of heart attack, because of this particular event, and it is described as a myocardial infarction. In general terms, in general languages, we call the same thing as a heart attack. Now, why does the heart attack happens? To explain you in a very simplistic way, it's nothing but a demand-supply mismatch. The heart is like a pump which pumps blood to the different parts of the body and that is how it supplies oxygen to the rest of the body. Now, for this heart to function, that itself requires blood for its functioning, and this heart muscle receives its blood supply with three pipes, which we call it as a coronary arteries. And whenever there is a complete shut off of one of these arteries, then it results into a heart attack, or what we call it medically is a myocardial infarction.
Here are some queries, sir, which you would like to answer. What are symptoms of a myocardial infarction? What will my pulse feel like during a myocardial infarction? Should aspirin be taken?
Fantastic. It's very appropriate question. The symptomatology, let's see what exactly happens during myocardial infarction. Myocardial infarction is usually the person gets a severe pain below the sternum, that is in the center of the chest. That is a usual presentation of most of the heart attacks or most of the myocardial infarctions. It could be just a pain. Sometimes it could be a burning sensation, or sometimes it could be just a heaviness. And many times whenever there is a heaviness or burning sensation, we often get confused with gases and gastritis. And every time it may not present as a chest pain alone. Sometimes patient can present just with a breathlessness. Sometimes a syncope, that means you may just fall down, or sometimes it could be a giddiness or palpitation. And many times you have an atypical symptoms also, like it could be just a confusion. It could be just unexplained reasons. So many times the myocardial infarction or heart attack can present itself in a different format, but the trick is to diagnose that and get the treatment. So all the symptoms for everyone may not be the same. Usually, most of the time, it is usually the chest pain, which is the forthcoming symptom. And again, the chest pain, what we have seen is, the chest pain is pretty prominent in younger people. But as the age advances beyond 60 and beyond 70, the pain may not be the presenting feature. They may present it with a different constitutional symptoms like the breathlessness, uneasiness, giddiness, or palpitation. Now, what should we do? The questioner asked that, shall we take an aspirin? I strongly recommend that anybody who's getting a chest pain, which is suggestive of a heart attack, if you suspect that it is a heart attack, then please give them 325 milligrams of soluble Disprin. I'm again repeating it. It should be at 325 milligrams of soluble Disprin. So what I request the general population is that kindly remember this, that heart attack is not confined to a particular age group or to a particular section of the society only. It can happen to all of us. It can happen to anyone. And in due course of time, I will tell you that, the younger people in India are suffering more and more because of the heart attacks. So this can happen in anyone's house. So my request is, please make sure that in your house, you have at least one strip of soluble Disprin tablets with you. Because when it happens, then you keep running here and there. And because many times there are patients with you, maybe the parents who are taking already, but they generally will have an enteric-coated aspirin, that is Ecosprin. So don't give Ecosprin when somebody is having an ongoing heart attack. So who are the people who should receive aspirin? Literally every person in whom you are suspecting that person may be suffering with a heart attack, give them a 325 milligrams of aspirin unless only if somebody has got a gastric ulcer with a bleeding, somebody is vomiting blood because of from the ulcer. These are the people should not be given an aspirin, but rest of the guys should be given an aspirin. The first treatment for the myocardial infarction should be a 325 milligrams of soluble aspirin.
So there's another question.
Yeah.
What is the first aid to be given to a person suffering from silent ischemia before the ambulance reaches home? Again,
very relevant question. I would suggest that, the way we do it for the other things, it is nothing wrong if you really do a recce for your heart attack. Recce means what I would say that, one should, in a family, should be mentally prepared that in an unfortunate event, in sometimes if a heart attack occurs to any of our family members, how do you do? What do you do? Because I have seen most often that it is only after the occurrence the family members, they get into panic mode. At that time, they really do not know what is the ambulance number, which ambulance to be called, which hospital to go, which doctor to be called. And I'll tell you that in heart attacks, the key to treatment is not the tertiary care hospital, not the senior cardiologist, not the great hospitals, nothing. The key to success is the time. Time is muscle, time is everything in heart attacks. So the faster, sooner you can reach a well-equipped hospital, better would be the outcomes. So right from the word go, please remember that time is the critical thing. So at that moment of time, you should not take time to make calls to different people, get your ambulances and other things. So kindly make a notepad somewhere, keep the ambulances numbers which are in emergency should be there. Those people should be called. You should do a small recce. You should be aware of it, that what are the hospitals are around in your locality, which is a better equipped hospital, which is a hospital in case of emergency angioplasty can be offered or not. So these are all the things one check should be done beforehand. And finally, if somebody gets it, the first thing I would suggest is make him rest. Don't make the person walk if you're suspecting a heart attack in that particular person. Many times, somebody is staying in a 5th floor or 6th floor. Don't make him walk down all the floors down to the ground floor and then put him into the ambulance or put him into the car or put him into the auto or anything like that. So the first step is the person should be made to rest. He should immediately be allowed to sleep on a bed, on a sofa, or wherever it is, and then he should be allowed to rest. Once it is done, if you have a Disprin, please give 325 milligrams of Disprin and then try to call the ambulance immediately. Try to get the paramedic. If you are suspecting it, or otherwise also, if somebody has got a pain which is not a usual pain, one which normally suffers during a gastritis or during a normal gases. So if someone feels that his pain is little different or atypical from the usual gastric acidity pain, please go to the nearest possible doctor and get one 12 lead ECG. It is always better to rule out the heart attacks before it can really do a damage to us.
There's another question, sir. Does myocardial infarction happen to a person who has some blockage in the coronary arteries, or is there any other reason for a myocardial infarction?
Okay, it's interesting because that means why myocardial infarction happens. The myocardial infarction or heart attack is because, as I said, that it is because of the clogging of the blood vessel. The blood vessel of the heart vessels, they get completely clogged with the clots, and that results into a heart attack. Now, this clogging or this clotting mechanism or the aggregation of the blood cells can happen due to various reasons. The commonest thing is because of the deposition of the fat into the arteries, which slowly and gradually increases into a blockage. And whenever there is a rupture to the innermost layer of this blockage, that will get into contact with the blood and it results into a clot and then blockage of the complete artery. But sometimes, without even having this atherosclerosis, that means the development of the small fat molecules on the inner side of the surface of the artery, the clots can be migrated from some other place also, which we call as an embolism. So there could be an embolic clot which can go and probably can block the artery, and sometimes simply the spasm of the coronary artery also can lead into heart attacks. This is what usually the scenario in the young people. What we have seen of late is that the young means those who are below 40 years, even those people are having heart attacks of late. And in India, almost about 12 to 14% of the complete total heart attacks, the younger people are people having below 40 years are occupying about 14% of the total heart attacks. So you can see that, which is compared to the Western population, is far more ahead. In Western population, it is hardly 3 to 5% people. So if you really see the overall heart attack scenario, it is definitely quite disappointing in our country, because if you really see the statistics part of it, there is roughly about 3 million, that means 30 lakh heart attacks are occurring every year in our country. So 30 lakh people are suffering because of the heart attacks every year. And out of these 30 lakh people, literally the almost to the tune of about 16 to 18% of the people they are dying because of the heart attacks. So despite all the treatment and other things, because of they don't reach timely, or even if they reach timely, it's too late. So first 30-day mortality is very high in this scenario and in this particular disease. So the time is an important thing, and the causations are, one is of course the fat deposition in the innermost layer of the heart arteries, or it could be embolism from some other sources can result into heart attacks.
So there's another question. Being on a blood thinner since long, is it possible to go through a myocardial infarction?
Okay. Yes, basically the blood thinners, there are two types of blood thinners are there. Normally after the patient undergoes an angioplasty or bypass surgery, essentially that person will be put on an aspirin and probably the clopidogrel or the other antiplatelet agents for initially 1 year to 2 years. It is possible that after although the patient is on an aspirin and the antiplatelet agents, and despite that also patient can have a second heart attack, which occurs rarely. It doesn't happen in all the patients, but few people can get it. But that means the disease is pretty malignant in that person, and it needs to be treated aggressively, because many times the single thinning agent is not efficacious enough to prevent the further clots. So it is possible that there are some people who can still suffer despite being on the blood thinners.
Can stress or overexcitement be a cause of myocardial infarction? Does heavy pain in the chest relate to a myocardial infarction?
Again, a very wonderful question, very nice question, because does the stress play any role in the causation of heart attack? Before that, I would discuss that what are the factors which can result into a heart attack. So broadly, there are two types of factors. One is a modifiable risk factors and another one is a non-modifiable risk factors. Modifiable risk factors, I'll describe them. Non-modifiable are age, and it is mostly preponderance in male people and beyond a certain age. So anybody who's above 45 males and anybody who's above 55 more likely to get a heart attack. It's more common in males, and so these are the non-modifiable risk factors. very little can be offered to do anything about it. But what are the modifiable risk factors? The biggest risk factor for causation of heart attack, in my view, is smoking. So, and smoking is one of the main reasons to have heart attacks in the younger population. So I feel that all efforts should be done to stop smoking, to stop tobacco abuse in whatever form may be, because there are many times it is active smokers and there are many times passive smokers. Passive smokers are also the victims of the heart attacks. So smoking is one of the main reasons, because it has a nicotine, and which actually even after a single cigarette for next 24 hours, the coronary arteries can go into a spasm. So smoking should be addressed, should be fought very aggressively if we really want to contain myocardial infarction. The other risk factors are the diabetes. Diabetes, already India is a capital for the diabetes. Diabetes makes the person 3 times more prone to have a heart attack compared to a non-diabetic person. So again, you should have a very efficacious control of the diabetes to control the heart attacks. The other factor is the hypertension. So high blood pressure people are again prone for heart attacks. So again, we suggest that the blood pressure should be regularly checked up, should be controlled very effectively, and proper medication should be taken. Many times what happens is we have seen that 50% of the people don't get the treatment, and even if those people who are on the BP blood pressure medication treatment, the only 25% of them are in the proper medication, or which is controlling the blood pressure. It doesn't make any sense that you just keep taking a single pill and your blood pressure continues to be high, because your risk to have a heart attack continues to be high if your blood pressure is not well under control. So this is the third risk factor, which is again responsible for the heart attacks. The other thing is the cholesterol abnormalities. What we call it is as a dyslipidemia. There are again many subsets of the cholesterols, the good cholesterol and the bad cholesterol. The total cholesterol and LDL cholesterol are called bad cholesterols. They should be controlled, they should be contained, and good cholesterol is an HDL is called as a good cholesterol, and every attempt should be made to improve the HDL or increase the high density lipoproteins. Similarly, in Indians, what we have seen is strangely, our lipid profiles are different from the Western populations. In Indians, what has been seen is we generally will have a low HDL levels and high triglyceride levels. So this is again a peculiar combination specific to our Indians, because we may not have an increased LDL levels or total cholesterol levels, but high triglyceride levels with abdominal obesity, with low HDL level is a typical character of an Indian male who's getting a heart attack. And also we have seen in the younger population, those who have the reasons for having a heart attack in a younger population is smoking, to the first thing, and second is the low HDL levels, hypertension, and high triglyceride levels. So these are the 4 possible risk factors for having a heart attack in a younger population. Now coming to the point is that whether other than this, any other factors which can result into heart attacks, we are seeing very regularly that of late. In fact, I can discuss with you one single case just about last month. I had one guy, 22 years, he was just passed out in engineer, and unfortunately he was not still employed. He was a little under stress. He had some altercation with his father in the evening, and within 2 hours he presented to us with a evolving massive heart attack. And this patient had to, and he had a ventricular tachycardia, fibrillation. We really had to give several shocks to get his rhythm back. Then night itself, we wheeled him into the cath lab. We had to do an emergency angioplasty, and that's how we could save the patient. And here, the only causation of it, he had a severe altercation and fight with his dad. So acute stresses can precipitate heart attacks. What happens is there are something called as the stress hormones. Stress hormones are there in the body, like adrenalines and corticosteroids. Whenever a person is having a rage, fear, anxiety, all these things can increase the stress hormone levels, and they can immediately cause, either they can cause the clotting of the arteries, or they can lead to a spasm of the coronary arteries, and thereby which can result in a heart attack. So I suggest that yes, physical and mental stress could also be one of the reasons for having an increased incidence of heart attacks in our younger population. So please start doing a lifestyle modification. Please start taking the yoga, meditation. These are all should be a part of our life to control our stresses.
So we have another question from a viewer, Mr. Zishan Jafri. Yeah. Is recovery possible after MI, myocardial infarction?
Absolutely. That is why we are doing it. if your point is very good, recovery, okay, it is not the cure, because whatever is the muscle damage which has happened, whatever is the death of the muscle, we can hardly do anything about it. But yes, we can save the rest of the myocardium, we can salvage as much as possible the tissue around the damage. So that is the reason I said at the beginning that time is the critical factor. The faster you can come, faster we do the procedure, faster we can salvage it, the larger part of the muscle we can salvage it, and that's how, you know, we can save the person. Not only save the person, we can reduce his damage, and we can make him as much as possible fit for the future for him for the rest of his life. So what do we do with these things? So once, going back to the first point, is once somebody gets a heart attack, after giving the preliminary treatment of aspirin and other things and shifting the patient, if the patient can reach a hospital in less than 2 hours time from the time of the onset of the symptoms, then all these patients should undergo essentially a primary angioplasty. Primary angioplasty is a gold standard treatment today for evolving heart attacks. And what is primary angioplasty is, that means you take this patient into the cath lab, into an operation theater, and where you open up the blocked artery by a balloon or by a clot suction device, and that's how you restore the blood flow in that particular artery. So this is called a primary angioplasty. That means doing an angioplasty during an evolving heart attack is called a primary angioplasty. So the gold standard is a primary angioplasty in all those patients who can present within 2 hours of it. But in case, even in the city of Hyderabad or in any metropolitan city, where you, although you are staying in city, but you are very far off from any good center where the tertiary care facilities are possible, or because of the traffic jam or because of whatever reasons, in case if you feel that you are going to get delayed by more than 2 hours or more than 3 hours, then my request is, my suggestion is, go to the nearest nursing home or the hospital or whichever is the primary care hospital, where a clot buster or clot dissolving injection can be given, what we normally call them as a thrombolytic. And once we give a thrombolytic, because first hour is called as a golden hour, if we can give this injection in first 60 minutes, it works as good as a primary angioplasty. It can work wonders. So especially in our Indian population, where majority of the people stay in the villages and the remote areas, where the transportation is a big question, ambulance services are still in doubt. So, and although you may be staying in a city, but if your transportation time is going to be more than 2 hours or more than 1.5 hours to 2 hours, take them to a place where a thrombolytic injection, that is a clot buster injections, can be given. Control the situation, and within 3 to 24 hours, the patient should be shifted to a center where the cath lab facilities are there, and the patient should be wheeled in to do an angioplasty, rescue angioplasty, or planned angioplasty. So that should be guidelines, and that should be the framework of any person who's having a heart attack.
So there's another question, sir. More of them are asking about the diet. So what is the healthy food, lifestyle, exercises suggested to prevent a myocardial infarction or heart failure?
In a one single line, I would say whatever you like, you don't eat. That should be the healthy diet. But coming to the reality is, I agree that the dyslipidemia, as I said, the high cholesterol levels, bad cholesterol levels, mainly responsible because of our diet. So for non-vegetarians, I would say that try to take fish more often than the other non-vegetarian foods. Like chicken and mutton can be taken in moderation, but not too much. And again, it should not be too much of a fried food. It should not be a fried chicken and fried mutton, and those things should be avoided. Fried fish also should be avoided, but fish should be at least 2 to 3 courses per week is a recommended doses for the non-vegetarian. For the vegetarians, of course, avoid too much of a milk products, avoid too much of a butter and ghee products. And lot of fruits, lot of vegetables should be taken, consumed every day. So if you can increase your diet with vegetables and with fruits and with a daily exercise, physical inactivity is also one of the main reasons for causation of the heart attacks. Again, we are seeing in younger population, all types of physical activities are coming down day by day. They hardly do any sports. They hardly go any exercise. So kindly do the daily routine. It should be at least 30 minutes to 45 minutes. A simple method is every day 4 to 5 kilometers of walking for 45 minutes, even 5 days a week is good enough to control your cholesterol levels and keep your heart healthy.
So there's another question, sir. For a diabetic, how much will be the HbA1c for a
HbA1c should ideally be, actually we call it as a cutoff limits of 6. But if the person is diabetic, is already having a coronary disease, he had an event, so anything below 7 is desirable. Anything below 7 is good. But if somebody's HbA1cs are crossing above 7, 7.5, definitely consult your endocrinologist and try to bring down keep the HbA1c levels below 7. Because diabetes is again a pretty bad disease, because it is nothing to do with sugar levels alone. High diabetes and diabetes over a period of time is almost like a termite. It literally chews your arteries, not only of your heart, but all other important vital organs like brain, kidney, and other organs. So we have seen that whenever a person is a diabetic, the coronary disease is pretty diffuse, triple vessel disease, all the 3 arteries are involved, and extensive disease is seen in diabetics. So again, as I said at the beginning, that India is a capital for the diabetes. India is capital for heart attacks. So with this, and genetically we are prone to have a heart attack. So overall, we are in a pretty bad state of affairs as far as the heart attack is concerned. It is almost taking an epidemic in our country. So aggressive lifestyle management, aggressive control of the risk factors are mandatory to control the heart attacks.
So one more last question and we'll wind up the session. Being just 32-year-old and suffered from a mild heart attack and undergone angioplasty, is it still possible for another myocardial infarction? What can be done to avoid?
It is unfortunate that at the age of 32 you had a myocardial infarction and then you had to undergo an angioplasty. But yes, if you are careless, if you are not careful, yes, you are a possible candidate to have a heart attack again. So to prevent that, I would say that take regular medication, go to your cardiologist once in 6 months, once in 3 months, get your checks regularly done, and keep your lifestyle under control. Do regular exercises, check your homocysteine levels, because even that could be the possible reason for having heart attacks in younger people, because they generally will have a high homocysteine levels. But yeah, if you're smoking it, stop smoking completely and take a healthy diet. Thank you.
Thank you so much, sir. Viewers, I hope all of your questions have been answered, and I think now we'll wind up this session. Viewers, please rewind this video and you'll find all your answers. So thank you so much, sir, for joining us in this session. And anybody of you would like to book an online appointment or direct appointment with Dr. Shiv Kumar, do visit or log on to www.askapollo.com. Thank you, sir.
Thank you so much.